I have worked as a regional coordinator and also helped implement several social protection programs in Africa. Instead of giving just a general overview, I just want to share the experience. I think the experience for me really tells a lot. So I'll share 3 experiences on how we have used a rights approach to support social protection and social protection to support the hard to reach people. So I just begin with the truth is that to access health or to help communities access health, the hard to reach people, we really need to understand what is the underlying problem. So I'll give an example of where the underlying problem was discrimination due to witchcraft accusation. This program was held in Burkina Faso, and we can be able to see that witchcraft is already a harmful practice. So even if we are thinking about health, these are people who are unlikely to be targeted. They are unlikely to even have the cards to be able to go and access, to even know about the entitlements. So the intervention here will be a lot. It must, first of all, have a livelihood component, which will help the people to be accepted in the community, to become visible. And we're also talking about people who are illiterate at the same time. These are the hard to reach people. So it is important to be able to carry out a research to find out what are the underlying problems. Even if you're going to do an intervention in health, it's good to be able to also address the underlying problem. Otherwise, it will not be sustainable. That is at least a lesson that I learned. And one of the things that we need to do is to act at various levels. And to act at these various levels, of course, we need funding. You need a system which enables the hard to reach people to be able to be heard, including participation in human rights, universal periodic reviews. So we participated in that, where we're writing and saying, look at the women, the children, a marginalized group. So how can we be able to reach them with a social protection or even health? So we had to address all of those things in tandem, and it involved quite a number of people. So definitely good research and understanding what really makes the difference. Like in Burkina, actually, the intervention was on water, because water and sanitation were big problems there. So here we are targeting to improve the health and livelihood of the people, and also to improve their accusation due to witchcraft. But we used a health strategy to be able to address a harmful practice. So I think it's very important to be analytical in terms of social protection. What is it really meeting? Sometimes it may be direct. Sometimes you need to address an issue that is causing the problem. In Ghana, we had a good problem there, where we were looking at, of course, Ghanaians have a national insurance, hospital insurance, and it was particularly for the whole country, community, especially, but now we were focusing on older people. In this case, the main problems were the structural barriers and lack of information. So the entitlement was there, people were not aware of it, and there were no structures. So now we're looking, again, when you look at access to healthcare, you are saying, yes, the entitlement is there, but do they know that the entitlement is there? Do they have the documentation? Can they be able to confront the government? So one thing that was critical there, again, we needed to have, to support the community to have a voice, monitor how many of them are actually accessing this particular healthcare, and then document this. And then also using international days, specific days, lobby. And when you're lobbying, you really need to develop very clear, okay, you have given us the health entitlement. But when we go to to the health facilities, we're not getting the medicine. The only medication is let's say, paracetamol, but there's no medicine now for non-communicable diseases, So they are very subtle, hard, health-specific health morbidities which need to be addressed through advocacy. This is a right now to health. And lastly, I just want to share a good practice now in Nigeria, which I also heard about, where people who had already been funded, who are getting cash transfer, realized their problem. Mainly it was actually childbearing women, and they had a very high mortality rate for infant mortality. And they were very far in a very remote area, no infrastructure. So what did they decide to do? They decided now to use the cash that they were getting to make a contribution to buy an ambulance for themselves. So we can see also now with that, the member of parliament to also now scale it up. And now with that, they are now able to go to hospital with no major ado. Now, we can see that it is very important when we are looking at health or health as entitlement to use a rights-based approach. Otherwise, it becomes, it will not be sustainable. But so we see now there's a role for the CSOs here. The CSOs, we as a CSO, we have a role to support structural barriers and discrimination. Even though it might be health that we are looking at, we have to see what is it that we need to be able to address in order to achieve what the social protection entitlement is supposed to achieve, for instance. And then we also have to try now as CSO to work at a higher level in terms of participation in policy planning, scaling up of the good practice, documentation of good practice, which can be evidence for government and other people to learn from. We need data, we need research on a regular basis to be able to say, okay, so even if it's scaling up, what are we going to do? Or are there some, for groups, if we need some groups to be in scaling up, we need, for instance, to say we need to include such and such a group. What is the evidence? What is a good practice? All of that, we need to do that as well. And then also strengthen community monitoring and evaluation processes so that they can see it is our thing. This is really meant to increase ownership. And lastly, I would recommend that we also work with the private sector, because it is a private sector now, for instance, that is giving out the cash transfers that are given most of the countries, including Kenya. And so it is important that also their capacity is built so that they can be able to engage with the government. And for 6 months, you find even the payment is not coming. So now what do they do? When the payment is not coming, it's important for CSOs also to increasingly work with the private sector so that it is seen as a unit and not just fragmented work. So it's a whole system. And so there are so many gaps. And in order for us to achieve and say we have been able to achieve, there are so many gaps that we need to analyze and say, so in addition to this, what else do we need to do? Health, you can't have health without a livelihood support, because the doctor tells you, take this medicine after food or before food. Thank you.